Good morning. It is Saturday, and there is no place I would rather be than right here in the studio with you and pharmacist and clinical nutritionist Greg Russell from Fort Wayne Custom RX. Good morning, Greg.
Good morning, Lee.
Good to see you again. We're going to be
Likewise.
spending some time talking today about nutrition and specifically a problem that can come along after you've been on a prescription medication for many years, and that is nutrient depletion. So give me the big picture on that.
Yeah. So, it's interesting. This is kind of a new topic in the world of pharmacy over the last few years, but there's been lots of good documentation now about patients, especially our elderly patients, when they've been on medications for many, many years. There's this compounding effect that can occur when we're using different medications that start depleting certain vitamins and certain minerals. And so, one of the big concerns is there was a 2017 study that showed that seniors that take 3 or more medications were at very high risk of being depleted at least 1 or more vitamins and minerals.
And what can the impact of that be? What can go wrong?
Well, so, when we start looking at things like, let's say, calcium, if we have a depletion of calcium and somebody's on a medication of 10, 15 years that's been depleting their calcium stores, that might put them at a higher risk for developing something like osteoporosis. And, of course, osteoporosis leads to broken bones and hip fractures, which, of course,
leading cause of death. Yeah,
it can be a leading cause of death in the elderly.
Yeah,
right.
It sure is. Okay, so that's pretty serious.
Mm-hmm.
What kind of medications are we talking about here? Is it anything exotic or just kind of ordinary stuff?
Well, a lot of it's ordinary medication. If you really think about it, and we could take a step back and look at how the world of pharmacy has evolved over the last 20 years. We're seeing now patients being started earlier, and that's good for their health benefits. They're getting started earlier on medications, but they may have something like hypertension when they're taking multiple types of medications. And again, to get earlier on, get control of that heart disease. But on the flip side of it, you have to be concerned a little bit about what the impact is on their nutrients that are occurring daily.
Yeah. Mm-hmm. So if you have a question about any of that, the phones are open at 800-333-1190, 447-1190. And you can text a question about a med you might be taking to 46862. And Greg's here with us in the studio. We'll get him to give you an answer. Okay, so let's start walking through what are the drugs combinations that I need to be most focused on?
Sure. So, for example, if we just take a look at some of our big minerals, magnesium, calcium, potassium, phosphorus, those are minerals that are good for bone health. We know that many of those medications are eliminated through the kidneys. Mm-hmm. Okay? So we're going to have, when we start talking about medications themselves, they can affect many different ways, and I'll give you some different examples today, but let's take a look at the kidneys first. If we were taking things like diuretics, okay, especially water pills, right? Those how those medications work is they reduce the fluid out of your body, but when they're getting that kidney action to work, because certain types of diuretics, the ones called the loop diuretics, and that's commonly drugs like Lasix and budesonide are very common. Those medications are important. They're used in heart failure and hypertension and other diseases. But as they take water out of your system, they're also taking some of these important minerals, such as calcium and magnesium. And again, we talked about the importance of calcium for bone health,
right?
But magnesium is also very important. So if we take a look at magnesium, I always call magnesium the forgotten mineral. It's been predicted that roughly 3 out of 4 Americans are low in magnesium in their diets.
Really?
Yeah. So if you take a look at what magnesium is a mineral that's found in plant foods. It holds chlorophyll together, so anything that you eat that's green is going to have magnesium in it. So if bigger, deeper program here, but we can make that argument that Americans don't eat as much plant food as they used to.
Sure.
Okay.
Yeah.
And so if we're not getting magnesium in our diet, and we know magnesium is important for so many different enzymatic reactions. Remember, enzymes are things that create those chemical reactions that we need to sustain life. And magnesium is kind of like the little spark plug that turns on some of those enzymatic. And so anytime we see people that have high sugar diets, higher carbohydrate diets, those tend to are running higher blood sugars. They tend to use a lot of magnesium in there to kind of help maintain their health.
So, how do I know well, give me some symptoms that might be a sign that I'm magnesium depleted.
Well, the biggest one that I see that comes in quite often is a lot of people come in and say, I'm getting Charlie horses. So, something simple like a little cramping, that's a real common one with both magnesium and calcium. We'll have some Charlie horses. Some severe cases would be you get some tremors, or you'd even get some paralysis. So, and generally we don't see that.
Sure.
But again, simple, magnesium is a very inexpensive supplement to supplement with. You can buy magnesium for a few dollars.
Right. And is there any reason for me not to just be on a magnesium supplement all the time?
Well, there would be if you had a severe form of kidney disease of some nature. You wouldn't want to just do it. But for most Americans, magnesium is one of those top 5 supplements that I recommend. I take some, every night at bedtime because it's very calming. It has a calming effect, but it's just an important mineral to have. And if anybody who works out, does a lot of athletic, they tend to sweat out a lot of magnesium too.
Wow. So isn't that interesting? And that's probably something your doctor is not going to be talking with you about.
Well, it's kind of like an indirect thing, and it takes some years to build up. But, probably our young kids, it's not so much a problem. But as we become more adults and as our body eliminates more magnesium, it has those additive effects.
So that is magnesium. What are that's a mineral. Are there vitamins we need to be paying attention to?
Yeah, the big ones that, we've talked about in the past is, we talk about how different medications affect, for example, coenzyme Q10. Okay, coenzyme Q10 is kind of similar to vitamin K, and that it's involved in the process of the cholesterol formation. So when we take drugs that block the production of cholesterol, they can also block coenzyme Q10. Well, coenzyme Q10 is what I call the master kind of your heart and your organ anti-coolant for your body. Okay, coenzyme Q10 stops the free radicals that form, and it's really important for anything that uses a lot of energy. So that would be your brain, your heart, your kidneys, your liver. That's where coenzyme Q10 is going to work.
And what medications affect that again?
Again, a lot of them is the big statin medications are real important, but some of the beta blocker drugs also do that.
We've got a phone call that I want you to answer, Greg, so put those headphones on for me. And let's jump out to the phone line and go ahead with your question for Greg Russell, pharmacist and clinical nutritionist from Fort Wayne Custom RX. Okay, are you with us there? Go ahead.
Yeah.
But there you are. Now we can hear you. Let's try that again. Would you start over?
Okay, my doctor put me on this pill to build up my bones. It's ALENDRONATE, sodium. Will that help? I've only been on it a few months. I just didn't know if it really will help build my bones.
Great question. So these are the type of drugs that are called biphosphonates, and their job is to help change the bone turnover rate that's occurring in your bone. So bone is living tissue, and when we're young, we're building more of that bone tissue. As we're growing, our bones are growing, and somewhere around our age, mid-20s to late to early 30s, for females and males both, we start to see kind of a rebalancing. In other words, we tend to be starting to build bone less, and because bone is living tissue, it has to be changed. So what that means is that over a period of time, new bone is growing, and old bone is being displaced. Okay, it's wearing out. So there's this kind of teeter-totter balance that occurs with the bone. So you got bone being built and bone being destroyed. And we know that that's under the influence of lots of different things, including hormones. And as a female goes into menopause, some women, especially those that are smaller in stature, those that maybe have a little less bone structure or maybe haven't done as much exercising, okay, and of course genetics plays a role in that, they start to actually lose more bone than they're building. And what alendronate does is it helps slow that process down, so that it slows that process down so that you're doing some bone building, but you're losing bone less rapidly. Now, it won't totally stop the process, but it slows it way down. So that is kind of how that drug works. And yes, it can be very impactful for somebody who has severe osteoporosis. So other things that you can do is make sure when you are using these drugs that you are taking some calcium. And I like a calcium, magnesium, phosphorus blend, typically with some vitamin K too, which we've talked about in past shows. But the reason why is you still need those nutrients to help build bone. Okay, that drug is just helping your body so it doesn't lose bone.
Oh, okay.
Does that make sense? What I said?
Yeah, it sure does to me. So it stops the loss, but then you also have to add those other items back in.
That's right. You want to not only slow that growth, but you want to give those factors that help support bone growth.
All right. Well, hey, thank you for your call. We need to jump out to a commercial break, and we'll be right back. Talking with Greg Russell from Fort Wayne Custom RX about drug-induced nutrient depletion, and we're going to focus on vitamin B12, why that's so important, and medications that can steal that right out of your body when we come back. And we are here in the studio with Greg Russell, clinical nutritionist and pharmacist at Fort Wayne Custom RX. We're focusing this half hour on the problem of what happens when you take multiple medications over a course of years, and what does that do to your mineral balance and vitamins as well. So, Greg, I want to jump into B12. That's a very important vitamin that is easily depleted.
Yeah, that's a very large, very important in our body. B12 functions a lot of different purposes. It's important for our nervous system. It helps make basically brain chemicals. It's also involved with insulin production, and of course it's involved in our red blood cells. So there are certain forms of anemias that can occur when you run low on B12. So probably the classic two drugs that have the most impact, and I'll talk about one that's lesser known, is the what we call the PPIs, or those are those little purple pills that they talk about for your gut, omeprazole, and as a class, there's a whole bunch of them, and there's drugs like Zantac and them all. And how those drugs work, of course, is they stop acid production in your gut. What we have to understand is B12 is extracted primarily from proteins, and of course animal proteins is one of the best sources, and you have to have an acidic gut to be able to extract that from them proteins. So when we change the pH by moving the pH up, kind of like when you think about Alka-Seltzer or sodium bicarb changes the pH. When you add it to vinegar, it causes bubbling, okay, and that's neutralizing that pH. Well, the same things are going on with the B12, when we add those type of drugs over a period of time, and again, long-term effects is what we're talking about. Metformin is another drug that's commonly used.
Oh, widely used.
And I could tell you a lot of metformin users are also on those PPIs. So when we start, because metformin will upset the gut itself, so we tend to find that people tend to be on those things in combination. And that's what I'm talking about. You get the 1-2 punch, when you get into some of these different drugs. Also, something that a lot of people don't talk about is that what about long-term birth control use? Okay, so again, people tend to be, for family planning, they're on birth control pills, and one of the undesired effects is those can have an effect on your B vitamins absorption and some of your minerals such as zinc. So what we again recommend, and the OBGYNs know this now, when somebody is pregnant, they put them on a prenatal vitamin, and usually it's loaded with folic acid. And again, that is one of the things that we get concerned when people are low on folic acid, because especially in a pregnant woman, the fetus, we know that the nervous system, the neural tube doesn't form. So again, it makes sense to me that if somebody's on a birth control pill, that they should be on a multiple vitamin, whether it be a prenatal prescription one or just a very high potency multivitamin with folic acid.
So what about women who are in menopause? Do they have any special needs around B12?
Yeah, and again, it seems to be women that are taking the oral estrogens are at the highest risk. The topical estrogens seem to have much less impact, but again, it's never hurt anybody to be on a B complex vitamin. And again, like we talked about magnesium, B complex vitamin is, again, something I tend to recommend quite frequently.
Sure, and a severe B12 deficiency is particularly in someone in advanced age, can mimic dementia and causes balance problems. It's a long list of problems.
Yeah, that's right. So it's serious, and so again, you can have your B12 levels checked. And in fact, I would probably recommend that if you could do it. So again, those standard blood tests that can be ordered from a doctor, even on that.
Tryptophan is something that people are also concerned about. Tell me more about that.
Yeah. So again, tryptophan is an interesting protein, an amino acid, in that it's actually used in the gut, and I'll take a step back on gut health. If you have problems, why are you on a PPI in the first place? Okay, so many patients are just buying them over the counter, and they're taking them long term, and sometimes without their doctor even knowing it. But again, having a good gut, and we've talked about this in the past, is imperative to good health. So tryptophan is made in the digestive tract, but what it does is it gets into the brain, and it makes the brain chemicals melatonin and serotonin. So we all know what melatonin's for. Melatonin helps us sleep, right? And serotonin is our natural antidepressant. So it is formed from tryptophan. Well, what we know is certain things, and again, here's our friends at birth control pills. It's a B6 dependent enzyme system that takes the tryptophan and converts it into serotonin and melatonin. So again, if you're depleting out certain enzymes, you're going to have a hard time making these brain chemicals.
Fascinating interactions. We've talked about it so many times. It does all come back to the gut sooner or later, it seems to, doesn't it?
It certainly does.
So we had a text question here about cancer therapies, and is there a concern for people taking cancer meds?
Well, cancer medications do a lot of, there's a wide variety of different type of cancer medications, and I'll be honest with you, I'm not versed on every cancer therapy anymore because they're constantly evolving, and that's, but obviously everything can be looked up. But what I would say is that cancer drugs have a tendency, many of them are very disruptive to the digestive tract in general. So again, you're going to have that physical barrier issue where you're going to have some breakdown of the gut, and part of the gut's job is to help absorb good nutrients in and keep bad nutrients out.
One of the things that you do that I think makes your practice different is personal consultation. So if you're one of those folks who's been on a long list of medications, talk me through that. How does that help? What can you help me with?
Yeah, so what we do is typically we're going to and this all goes through my nurse Paula at the pharmacy. But basically, what we do is we're going to collect some data from you. Yeah. We're going to get your list of your medications, and then I'm going to look through those medications and make sure they match up with what the disease process is that you tell us on the form. So, hey, you're taking over the counter Zantac, and I'll just pick on Zantac as a representation because we've talked about it so much. But if you're taking something like that, but there's you're not really being treated for that, we're going to look at it and we're going to say, well, how many years have you been on it? What is the interaction with other medications that you're on? Are you taking it properly? And then we're going to look at those potential nutrient depletions, and we're going to educate you as to what medications you might look at. And maybe indirectly, we're going to come across some other things, such as, hey, I am having problems with digestive health, and we may look at ways to help you, help support that digestive health in general.
And in order to get that consultation with Greg, it's just a phone call to Fort Wayne Custom RX.
That's right.
Schedule the time, and I think that's something that most people don't think about, the way to use a pharmacist, right?
Yeah, I think it's very important today. Medications have become so complex, and I can tell you sometimes the simplest things, we think they're simple, but my patients get very confused. So I think it's always good to have a review periodically.
Yeah, I think that is so true, particularly when you're seeing multiple physicians and you have prescriptions coming at you from multiple directions, and people don't know what these pills do or what, why am I taking this one over that one? And
they forget, sure. They just need a refresher.
Yeah, exactly. And that's a great way to do that. So that is Greg Russell. He is a clinical nutritionist and the founder of Fort Wayne Custom RX. You will find them online at fwcustomrx.com, or you can visit them in person at 425 East DuPont Road. Greg, thanks for coming in.
Thank you.